You talked a lot about sunscreen in there, and I love that you added something that killed off the rest of the free radicals. What was it again?
That was an antioxidant serum.
Gotcha.
So you need antioxidants plus the sunscreen to really neutralize all the free radicals.
And how often do we have to reapply sunscreen? And does sunscreen work through car windows?
Ah, excellent question. A lot of people don't realize that UVA rays penetrate through the car window. So in the U.S., we tend to age faster on the left side.
On one side of the face.
People come in and they're like, why do I have all these brown spots and wrinkles on one side of my face? And then in the U.K., they age faster on the other side of the face.
Because they're driving the other side, right?
Right.
So now we're going to talk about the thing that I think I'm most fearful of in life next to snakes, swimsuits. It's so...
Bikini season is just daunting for everybody.
It's just hellish.
It is. It
hellish.
is. Yeah.
But you're going to talk about the physical aspects of looking better in our swimwear. We're going to start out with cellulite.
Cellulite.
Ugh.
Which the majority of us have.
Makes you want to turn off the lights immediately. Okay.
You can be thin, you can be fat. And
I've seen the skinniest of actresses. Of course.
Absolutely.
It's unbelievable.
There's like 3 models in the world who don't have cellulite. The rest of us all have cellulite, okay? It's just a fact.
And those 3 women walk around pretty much naked all the time.
But everybody else is photoshopping.
And good for them.
They probably are naked all the time.
Okay.
So what is this? This is, when I think about cellulite, I think this is the easiest way to think about it. So the plastic bag represents the skin.
Right.
Now the marshmallows represent your fat cells underneath the surface of the skin. So in somebody without cellulite, you know, those marshmallows, they're nice and evenly dispersed. And in those 3 people,
they're ready to make us some more.
Right. They have the nice and even marshmallows. But in people who have cellulite, like the rest of us, you've got these fibrous bands that are represented by these rubber bands. And what they do,
they literally are constricting,
right? Exactly what they're doing. So you got a bulge, then you have like a pucker, then you have a bulge, then you have a pucker. So you're seeing on the surface all these irregularities on the surface of the skin. So in the past, you know, when it came to cellulite creams, how did they work? They worked by temporarily making it look better. So imagine replacing these marshmallows with like mini marshmallows. You know, they're not going to bulge as much. Right. But if you really want to get to the root of cellulite and really come up with a long-lasting solution, what do you have to do? You
got to break the bands.
You got to cut the bands.
You got to get rid of the fibrous material.
Release the bands. So if you release these
cutting
bands,
the sinew out of your steak, you know, right?
Exactly. So what is this doing?
Then it'll loosen it up and flatten the surface out.
Now you got your marshmallows. But do they have evenly spaced?
Do they have things that can do that?
Well, now we do. So now we're going to demonstrate with Sarah. So we have a procedure available now. This is called, it's called the Cellfina. And what it is, actually, I did this procedure on Sarah about a month ago. Okay. Sarah came to me, she's like, oh, I just want a long-lasting solution. I don't want any of these quick fixes. So what we did, now this Cellfina is amazing for cellulite dimples on the buttock area and on the back of the thighs. It is not good for this area right in front of the knee. So you got to pick and choose correctly.
What is that?
You may not be a good candidate for it. Right now, it seems to be working best here. And in that area,
it's not as effective.
Just not as effective. So right now, that's a good area for the creams. But for this area, this is the sweet spot. So the way that Cellfina works, so we can take a look at this video of how it works. So what it's doing is there's actually a vacuum. And the vacuum is sucking the skin, the fat, and the fibrous bands into this applicator and putting it in the perfect position in order to cut those fibrous bands and release those fibrous bands.
Well, how are you cutting them?
So, well, what I do is first I actually numb the area locally so that Sarah doesn't feel any pain, and then I take a motorized needle, and I take that motorized needle and actually shift it back and forth, and it cuts that fibrous band. Now, she's nice and numb.
If it made you look less dimply, you'd be like, all right,
you may grow. You may grow now, but Sarah's looking pretty good. All right, so now, Sarah, why don't you take off your robe, and why don't you stand up here and show the before and after. So Sarah was, I would say you were bruised for what, like 2 weeks or so before she was sort of bikini ready. Yes, so you do want to time this appropriately.
Here, honey, let me, there you
go. But it's
sweetie.
just nice and smooth, because when you release those bands.
Oh my God, look at the difference.
It's an hour-long procedure. It's about $3,000 to $5,000, depending on how many dimples you have. But now,
is it permanent?
We have clinical trial data now showing that it lasts longer than 3 years, and they're still following those patients.
Now, Sarah, did it hurt?
After the numbing, I didn't feel a thing.
Wow, but are you happy with the results?
Very happy.
It's amazing.
It really does make a huge difference.
You said it's about $3,000. How long does it take? I mean, how long does it take to physically do the procedure?
So it takes me about an hour in the office. But then for Sarah, you know, she was pretty sore for about 24 hours afterwards because, you know, sitting down, it hurts a little bit.
Right.
So, you know, the first 24 hours, you want to take it easy, and after that, you can resume your normal activities. But really, it's the bruising that I think is sort of that when you're timing it for bikini season,
Right.
you want to give your skin enough of a chance.
So get in
to
there
heal
like
from the
now.
bruising,
Right.
you got it.
Okay, now when it comes to the front of the legs,
What can we do?
That doesn't work as well, huh?
So, right, so the front of the legs, or if you want a quick fix and you don't want to come to the office for a procedure, this is Katie, and Katie was asking me, what can we do about cellulite for the area that we were just discussing? So with a dry brushing is what it sounds like. You use a dry brush on dry skin, and what you're doing is do you mind if I brush your, okay. So you actually want to do long, sweeping strokes from the knee in upward directions towards the heart, triggering circulation. So it's basically temporarily plumping the skin. Like when my grandma used to pinch my cheek before I took a picture, you know, it makes your cheek look a little bit more plump. So it temporarily camouflages. It's like thickening the plastic bag. It's like making the skin a little bit thicker for a couple
basically,
hours.
a stiff, just a really stiff, keep the brush dry.
You want to have this natural. You don't want it to be synthetic because then the bristles are too stiff and they can hurt the skin. So this is like a vegetable-derived natural brush.
Okay.
Like $5 to $30.
So, I just have to say to all of our viewers, it's very brave to come out here and stand around in your swimsuits in front of strangers. So thank you to both of you. Okay, so moving along now, we have Ilana and Elizabeth, and we're going to talk about something else that women are very self-conscious about when we get loose or a little bit of sagging skin, right?
Especially around the belly, because when you're getting ready for bikini season, the area around the belly. So the area around the belly, in women especially, we tend to get a lot of laxity, a lot of looseness. It's not toned and tight. Why? If you've had any kind of a weight fluctuation. Ilana just told me, how much weight did you lose?
150 pounds.
So she's all about the low glycemic index.
Started cooking for herself and has been working out.
Amazing.
That's the tag team you got to do. Congratulations, sweetheart.
So if you lost weight, if you had any weight fluctuations, if you were ever pregnant, you know, at a certain point, the elastic fibers in the belly, they're not going to bounce back so quickly. So you want to do something to tighten it up. So if you don't mind lying down for me. Sure. Oh, actually, if you want to show the audience what is the area that we're treating.
So we're trying to.
It's that belly area.
You're trying to just tighten it up a little because you lost so much weight, right?
It's almost like a deflated balloon.
Gotcha.
So what we want to do is I'm doing a procedure. This is called microneedling is the procedure. This is the collagen pin. And what I'm doing, we actually used a little bit of numbing cream on her belly for a few minutes before we started the procedure. You hear the word needle? And everyone's like, needles, oh my God, needles. This microneedling, extremely comfortable. Everyone talks to me through this whole procedure. They're like, oh, this doesn't feel like anything, Dr. Bowe. So not a problem as far as pain goes. So what I do is I actually just rub a little bit. I'm so sorry, it's going to be a little cold.
It's a little cold.
A little bit of gel, a little bit of hyaluronic acid gel on the surface of the skin. And then I take this needle. It looks like a little pin.
Look at your little ribs sticking out there.
I don't know if you guys can see this. There's 36 little baby needles.
Oh, it really is teeny tiny.
They're tiny, tiny, and I can actually make them go deeper in the skin, more superficial, depending on what area we're treating. Great for stretch marks, great for tissue tightening. And what I'm doing is it's going to tickle a little bit. I'm actually...
Does that hurt at all? It just tickles?
It's painless.
I love this. Look at that.
I'm usually the one that's really nervous about needles sometimes.
Right, she's very paranoid about needles, but she's like, this is cool.
This is painless. People don't even flinch when I do this with them. So what I'm doing is I'm basically painting almost a tic-tac-toe board of little baby micro wounds in the skin. So I'm making these tiny, tiny micro wounds, and I'm telling the body to heal those wounds. So the body starts to make collagen, elastic.
Wow, so it naturally makes your body fix itself.
Yes.
That is amazing.
It's incredible.
Let's see the before and after. Whoa, that is really amazing.
It's unbelievable. This is one of the only things out there for stretch marks and for thickening and stretch marks. Everyone used to come in, what can I do for stretch marks? I was like, oh my God, I hate hearing that question because I like, as a dermatologist, I like to solve problems. I'm like, no, not much you can do. This works. It really tightens the skin.
About how much would that treatment be?
Around $200 to $700 per area that you're treating, and you want to do it in a series. So she would see the best results if she did this once a month for about 3 months, and then to maintain the results maybe every 3 or 4 months
But
after
you know,
that.
that's making your body fix itself. That's what I love about
It's like
that.
a natural movement.
We'll finish you up, don't worry.
You can rest over here for a second.
I just said to Alana, I said, don't worry, we'll even you out and finish you up in a minute. And now Elizabeth.
So Elizabeth show us same issue, you know, so it's just that area right around the belly button that we want to tighten up. But Elizabeth's like, you know what, I don't want to come in the office and do a procedure. What can I do at home?
Right.
So
not everybody can afford, you know, that expense as well.
Absolutely. Yeah. So, you know, Rachel, I never recommend anything that I don't personally use.
I know.
So I love this brand so much that I actually became an advisor for them. What this is, it's called Dr. Brandt Sculpt.
Dr. Brandt's a great brand.
This is an incredible brand. And what I love about it is this is a cream. This is so cool. It's not just what's inside, it's how it's delivered. So what you do is you actually twist it, and then you push, and some of the cream comes out. You close it back.
Right.
And then I'm actually going to rub it in circular motions. This is my go-to firming cream. I use this every... It's got an ingredient called silicium, and the silicium actually firms and tightens the skin. We have silicium in our skin, and we
So again, it's a thing that's natural to our bodies.
But we stopped making enough of it over time, so this will firm the skin.
Wow.
These stainless steel rollers, they create enough sort of a massage to stimulate lymphatic drainage. So we just, as women, we just accumulate all this extra fluid in this abdominal area. So you want to mobilize that fluid. You want to get your body...
I'm going to try some.
Flush it out. This is unbelievable.
Okay, so we all get to find out if that works, because we're all going to go home and tighten up our skins with our Cellulite Sculpt. To Dr. Whitney, but our brave viewers again for coming out here. And, you know, she is one of the prettiest inside and out, and she needs no Cellulite sculpting whatsoever. Up next, Katie Lee's in the kitchen.